Good morning from Austin, Texas at the Combined Ophthalmic Symposium. We're pleased to have Dr. Kourtney Houser with us this morning. Good morning, Kourtney, and thanks for being with us.
Good morning. Thank you.
Kourtney, I know you moderated a great session yesterday, which is about advancing the way that we handle preoperative and intraoperative management in cataract surgery. And I'm wondering if you can share a few highlights, specifically some of the integrative concepts that had been discussed.
Yeah, it's a really exciting time for cataract surgery. We have some new exciting ways to streamline the process and also make a little more efficient time in the OR. So Dr. Donaldson talked about a lot of the intraop things that we can do as far as integrating pre-op calculations with intraoperative surgery and a lot of the systems that are soon to come out. She talked about the Zeiss system in particular, and also Alcon has some things that are coming. We also went over some of the intraoperative aberrometry processes with Aura, and most exciting, I think, is the new developments in the 3D visualization systems that we have.
Yeah, I'm glad that you mentioned that. Let's dig a little deeper on that, because I don't think a lot of us are too familiar with the 3D visualization technology. Can you explain what that is and how it works?
So there's a few different platforms that are out there, and Dr. Donaldson also said that she's going to try them for the first time next week, but a lot of us have had the opportunity to see them working and maybe even try them. So it's a way that we as surgeons can, instead of having to look through a microscope, be able to look at a screen or a monitor to give us a little more flexibility in our view and also really enhance the depth of focus during surgery. It's also great for people in the room that we're teaching, like medical students, residents, and the staff, to be able to look at the screen and see what's going on with a lot of detail.
Right. So I was going to ask, what do you see as some of the advantages to this? It sounds like there's some advantage in terms of allowing others in the operating suite to visualize exactly what's going on. But I imagine that there's some other advantages, such as positioning of the patient or positioning of the surgeon. What else do you see as a potential benefit here?
So positioning, I think, is a big benefit. As surgeons, we have a lot of back and neck problems. So I think down the road, once we get these systems optimized, we'll be able to really have a little more flexibility, not having to reach over on patients that are difficult to position. But also, I think it'll be great for teaching for residents and fellows. But definitely it'll save our neck and back some, I think, as well.
Do you think that there are any potential disadvantages of this type of technology?
I think it's always a learning curve when these come out, which is another thing we talked about, how to first start using these. You know, surgery is always different on different systems. Your depth of focus is a little different. So we talked about ways to start slow. The reps for these companies are usually great to come in and help to teach us how to use them. Trying to do several cases in a row helps. But also, whenever we're starting, there's always things that will happen where the assistant might not have as good of a view as the surgeon. So as they get optimized, it'll get better. But definitely some, hoops we'll have to jump through at the beginning.
Right. I guess I haven't had the fortune to use these systems myself, but I guess I always wonder, is the resolution going to be fine enough in order to really detect differences in layers? For example, like evaluating a posterior capsular tear or an anterior capsular runout. Is the visualization good enough to be able to appreciate that?
It's actually great. So the Z-axis, like the depth of our focus, is actually better in these systems than with a standard microscope. And our retina colleagues have been using this for some time, actually. I work with Dr. Charles in Memphis. He's at my surgery center, and he's been using it for years. And actually, for some of their more detailed work, like epiretinal membranes, he uses it a lot and feels that it really helps his view to be a lot better than a standard microscope. There's just some adjustments that I think we'll have to make it applicable for anterior segment surgery as well.
Good. Well, this is an exciting new technology. I'm so glad you're able to share your thoughts and your expertise with us. Thank you so much for being with us this morning.
Thank you.